Welcome back. If you've just joined us, it's 60 Minutes with me, Angela Ajitumobi. On my hot seat today, Dr. Anthony Owa. He's an ear, nose, and throat specialist. Well, in my hands, doctor, I have a pack of cotton buds. I'm very sad to have to throw this away. And I'm just looking at the side. Do not introduce into the conduits of the ears or the nose. I mean, it's written there in French, but that's what it says.
Yes.
So even the manufacturers of cotton buds know that it's not meant to be put into the ears.
Yes.
So,
and that's a disclaimer. So if you damage your ears or your nose from
Yes.
using the cotton buds, you cannot sue them.
what do they mean nose? That's a new thing.
In the nose, there are some people that use the cotton bud to clean their nose, to remove nasal debris and secretions and things along those lines. However, if you continue irritating the nose, especially the midline of the nose, it can cause an infection, which can be very uncomfortable, can cause cyst production, and in the worst case scenario, you can actually eventually drill a hole, because some people are addicted to cleaning their nose. You can actually drill a hole, which will result in a communication between both sides of the nasal septum. The septum is in the midline, and in between the septum, you may drill a hole through it. Because basically the nose is there, the septum is there to separate the nose, so it increases the humidification of air and also catch particles as it passes through. Now, in some instances, people use a cotton bud or rubs the area with the tissue. Over a period of time, you may well have a hole communicating between both sides. So now you get more prone to infections, nosebleeds, and also the hole gets larger, the nose can collapse under that, under the fact that it's no longer supporting it. And this, you have the same effect in those that abuse cocaine and sniff things up the nose, because it constricts the area, causes the tissue around there to be devitalized and die, and you have a communication eventually forming. So the nose can collapse under that pressure.
And I'm sure as we went on the break, you saw the shock on everyone's face.
Oh, yes,
so
I did.
I want you to reiterate it further now. For the sake of viewers who missed it the first time, no cotton buds in our ears.
Basically, nothing smaller than your elbow in the ear. In other words,
Your
do not
elbow.
put, yes, that's a saying we have in the UK, where even in the years gone by, people appreciate that you shouldn't put things inside your ear. So if you use a cotton bud, hairpin, drawing pin, the cap of a biro, the pen, what you're ending up doing is either pushing the wax back in, because the reason why you can see the wax is because the ear canal skin actually pushes things out on its own. But that's the reason why you can see the wax. But when you push things back inside, you can actually end up not only pushing the wax inside, which may get infected, you can bruise the ear canal, which can cause blood collection, which can also get infected. And you can also damage the eardrum, which can result in hearing loss. You can damage the small bones of hearing if you push hard enough, because it's quite long, and that can also result in hearing loss. Both the last two may well require surgical treatment to recover. And by and large, the ear canal may not be as short or long as because you cannot see it. The only person that can see it is someone looking indirectly, and usually the person should have some degree of ENT training to be able to assess and deal with problems in the ear canal. As a blind canal, it's like a close, and you can imagine you having a close and someone taking a trailer and going straight down the road, not knowing how far it is. At some point, he's going to go through things, and that's what you do with a cotton bud.
Wow, I'm sure everyone at home has gone and taken their pack of cotton buds now to read the disclaimer on it. That's really great information you're giving us this morning. So we're supposed to rely on the natural cleaning system that the ear has.
The ear will clean itself out, but what you can do if you can't wait is to, in the chemist you can have different wax dissolving agents, like at least the ones that I'm familiar with are Otrex, Ceramol, which is basically olive oil.
What do you do? You put drops in?
Put a few drops. You can generally speaking, I tend to advise patients, if they really want to clean the ear out, probably every month, probably 3 days every month, just put a few drops in the ear, morning and night for 3 days, and that will encourage the wax to come out, and it will come out when they're having a wash. So it will come out there. Sometimes you can clean the outside with a towel.
Yes. Well, when you say the outside, just
that's the outside
where
there.
the finger can touch.
Around that side. You can clean the outside with a towel, and sometimes you actually see a brownish marking. That's actually
Yes.
wax that's worked its way out.
Wow.
That you see when you wipe on the ear, because
That
that's not skin.
dry blackish
Yes.
stuff sometimes.
Blackish stuff, because as it comes out, it gets darker. As it gets oxidized,
Yes.
the wax starts getting darker and darker.
Yes.
Further inside, it's a lighter color, but when it comes out, it starts getting darker and darker, and that's basically wax.
So, remember when, growing up and your mother would say you didn't hear a word? Was it because of the wax?
Oh, so many things. Could have been the wax,
Yes.
which she may or may not have contributed to it, because when I was younger, I used to play with plasticine,
Yes.
and you can imagine plasticine, when you push and push on it, it gets impacted. So you can imagine pushing something that's soft into a blind canal, eventually become into a block and block the air canal. So it could have been that.